Good morning.
Good
Sorry,
morning.
2 minutes late. How's everything going?
Great.
Good.
Well.
Big day yesterday. Thank you both for your help. We'll see everyone today, but we have 2 discharges, I think, Miss Smith and Miss Woods. Miss Woods' sister's supposed to be in like now, so I was hoping we could start there.
Yep, got Savannah is the nurse. Let me call her.
Perfect. Okay, let's go.
Yes, we're getting ready to see Miss Woods. Can you join us? Thank you.
Miss Woods, is it okay to come in?
Come in.
Hey, it's Joe Swire at Hospital Medicine. Good morning. Great to see you again. This must be your sister.
Hi.
Thank you for making it, Joe Swire. It's nice to meet you. Whole team trickling in. I think you know this Kim, our pharmacist. Kay, our discharge facilitator. Of course, you know Savannah. I hear good things, but you tell me, how was your night?
Pretty good.
Good. And yesterday, I know you were kind of feeling like you were ready to go home. Are you still feeling that way? Cough better?
It's better.
Feel like it's getting better? And how's your breathing when you're up walking around?
It's better than it was.
Okay. Not back to normal yet, but getting better. Okay. Do you mind if I take a listen to you? Great. Just relax. Lean forward for me. Good. Big deep breaths in and out through your mouth. One more. Good. Relax. You've been eating and drinking okay? All right, great. You sound good. I mean, there's still some crackles down on the bottom and that side. I think they're getting better every day to my exam, and as important or more important, you're feeling better every day. So I really think we've made great progress here. I know we've just met. Do you have questions for me right off the bat?
Not so far.
Not so far. You let me know. All right, good. Well, why don't you sort of tell your sister what brought you in and what we've done and how we hope to keep it getting better.
I was having problems with my heart.
Okay.
Yeah, so you have heart failure. You're exactly right about that, and that, as you know, is a chronic condition. And I think that you're probably right. That was part of why you felt so weak coming in. But I actually think that pneumonia was a big part of what brought you in. And specifically, based on what we saw and heard, it sounds like you probably had pneumonia, which is why you were having the cough and all that stuff coming up, that then caused your lung disease, your COPD, to sort of flare. So the words that we'll use are pneumonia with then COPD exacerbation. What questions do you have about that?
None.
You think you could explain that to her?
I came in with pneumonia and COPD.
Okay.
Yeah, I think that's right. And we've given you antibiotics and steroids, and as well as the inhalers that you take at home, and I think that we've seen some great progress. Anything, Savannah, from your end?
She did get a little low on her oxygen sats last night. When she got back in bed, when she was done walking around, it went right back to normal.
Okay.
And
How low?
Like 89, 88.
Okay. So sort of on the border, but we feel like that's getting better, much better than when you got here, and so things are improving. What were you saying, sorry?
And she also has a PICC line still.
Oh.
Do we want to pull that before she goes home?
Yes, we do, and thank you for bringing that up. We had to put the PICC line, it's a sort of a long IV in her arm, because we couldn't get IV access elsewhere. I had forgotten it was there, but yes, we do want that to come out. Thank you. Please make sure that that comes out before you leave. We'll get that taken out probably right after rounds.
Okay.
Great, thank you. Anything else from you?
No.
Great. You guys have anything?
Yeah, so Ms. Wood, we had talked the last couple days about how you're Coumadin at home. We were having a hard time managing, and we weren't really keeping that INR in the therapeutic range between 2 and 3. So we had kind of talked about maybe trying a different medication that didn't require all those clinic visits and would be a little easier to manage. Do you remember the name of the medication we talked about?
It was something like Xarelto.
Yeah, that's great. So it's called Xarelto. The generic name is Rivaroxaban. So you might hear it called either one. And it is a lot easier to manage, and I think we had all agreed that that might be the best thing to start for now.
Okay.
So I think we're going to send you with a script for that when you go home.
And that's a blood thinner for your atrial fibrillation. Which, and you have a primary doctor, remind me? Is that right? Okay, perfect. And he or she can write for that long term? Okay, so if I get her a month, you think that'll be enough?
That'd be great.
Okay, perfect. Good. Anything from anybody else?
I'll try to schedule a follow-up with your primary care physician. Let me just verify your address. Are you still at 310 South Lumsden?
I am.
Okay. Now, you live alone, but your sister lives next door. So how much assistance can you provide for her if she, if she should need it?
I'm there for her every day except Monday and Wednesday. On those
Okay.
days I have to work. So if you need to schedule a follow-up appointment, it'd need to be those other days.
Okay, I can do that. Now, Dr. Sawyer, do you think she'll need physical therapy or occupational therapy?
I don't. I feel like you've been up and around. Savannah, you feel like she's been getting around okay?
I do.
So I think we can do without those things.
What about any oxygen?
No, I think that you're okay without the oxygen.
All right. So the last thing I'll tell you is that we'll get your follow-up appointments. It'll all be on your discharge information. And then we'll call you a couple of days after you get out of the hospital to see how you're doing.
Okay.
Sounds great. What questions do you have now?
Well, my biggest concern is when we get home, if she gets short of air, what am I supposed to do to help?
Yeah, that's a great question. if things get worse, again, we think things are getting better, and we're going to continue the treatments that she's on. If things get worse at home, then the first step is always to call your primary doctor. You'll get our information, of course, and have our phone numbers as well, but your primary doctor is the person that I would reach out to first. If at any time you feel like it's an emergency, then of course go to the emergency department.
Okay, and then my other concern is that she's a smoker.
She is, yes. And there's been some recent studies that she and I discussed that show smoking's bad for you. So like we talked about, we always encourage everyone to quit smoking. And we've talked a lot about that. You've cut down a lot lately and are interested in quitting. And so certainly we encourage you to continue that quest to stop smoking. It sounds like having someone supportive at home will be helpful too. Good. So please quit smoking. Thank you for bringing it up. And that certainly is contributing to a lot of what's going on here. Great. What other questions?
That's all, thank you.
Good. Anything from anybody else?
So I had written down that you were interested in having your medications filled in the hospital before you go home in our Med-to-Beds program. Are you still interested?
I am.
Okay. So we have had 3 days of antibiotics while you've been in the hospital with us and 3 days of steroids. So Dr. Swigart was thinking just 2 more days of each of those.
So 5 total.
So 5 total, and then we'll also send you with that Rivaroxaban or the Xarelto prescription, and I'll be sure to come back before you go home and we'll talk about all your medicines, get all your questions answered.
Any other questions for us now, guys?
No, thank you.
Great, you're very welcome. So we think, again, this was pneumonia that caused a COPD exacerbation. You've been getting your inhalers, you have those at home. You'll get steroids and antibiotics for the next couple days, and it sounds like we're going to switch your blood thinner as well. My name is Joe Swigert with Hospital Medicine. Thank you for getting better. It's a pleasure to meet you. Thank you for coming in. If you guys need anything, just let somebody know, okay?
Thank you.
Thank you.
Thanks, Nate.